Thank you for coming to watch Dr. Smith's video today. We encourage you to hit the subscribe button and the alert button. That way you can get notifications when he uploads a new video. Thank you for coming today.
So we hope you take the time to hear and think about, and if you have a book, read in the book about the concept and the topics that we talk about. They have a lasting effect. The intent is not necessarily to treat pain, but to make permanent, long-term correction with your whole family and your friends.
Thank you. Make sure you subscribe and hit the alert button. Have a good day.
Have a good day. So today we're going to have a discussion mainly focused on the principle taught on page 27 through 32 in the book. It's called The Body as a Triangle. You might wonder, why am I talking about this? The answer is simple. Number one, the medical model as practiced in the United States of America, which has been the standard of care for nearly 100 years, is failing drastically. According to the World Health Organization, who keeps track of mortality rates around the world on many countries, I'll give you a few stats. Maternal mortality, we're the bottom of the top 40 countries. Now, I would bet if I passed out a blank sheet of paper and asked you to write down the names of 40 countries, you probably struggle to get 40 industrialized countries. Or so when a young lady gets pregnant in the United States, they have more chances of dying than any other country in the world. Wow. With industrialized countries. What about babies? Babies born in the United States, of the top 40 countries, we're 38. Pregnancy currently is
38 in mortality. I mean,
there are 37 countries. The babies stand a better chance of survival for the first year. What we are doing currently in the United States with the medical model is failing, and the statistics prove it. That's not my word. That's based on the World Health Organization, on their data. Now, we have more scientific data, we have more technical diagnostic ability than we've ever had.
Well, we've got equipment too. We've got incubators for babies and all kinds of stuff.
Yeah, and they're killing them. We're just killing people more than, in fact, the last 2 years, your life expectancy went down, all of you, went down both in 2021 and 2022. The bottom line is, it's going down. Pregnancy is treated as a disease, and old people, they keep them alive on specialized equipment that they should let them die with dignity. It's hard to die with dignity in the United States. So part of the discussion today is around the concept of healing by divine design. And that's different than healing with thinking that medicine heals, because medicine does not heal. Medicine can save life, can extend life, but it doesn't make you better. I had a lady this week who had a little sore on her lip, and she wanted to know what was the best thing to put on it, because she's put a lot of things on it, and it seems to be getting worse. I said this principle: the body heals from above down and from inside out. It doesn't heal from outside in. Lotions and potions and all that kind of stuff, like you put oil on your skin that's dry, you put oil on the outside because your skin's dry. That's not the way it works. You put the oil in and let the body use it and create natural oil. Okay? So the concept in the book is to enhance your trust in your body's ability to heal naturally from within. And on page 27, we divide it into 3 main categories. The top is the mental, emotional, spiritual. That's made up of 3 components. Don't confuse them. They are separate. At the peak of the triangle is the spirit. That's the true you. And the greater your faith in the spirit, the greater your power. In the book I say this principle: the greater your belief in something that's true, the greater its power. If you kind of think that the body can heal, then you kind of heal. And you're going to all study the New Testament this year, and you're going to learn a lot about Jesus and who he healed, and who he didn't heal. And you're going to learn about you're healed according to your faith. You should, when you read those statements by him, you should take it to heart, because the same is true for you and I today. Okay? So, the spirit. The other part of the tip of the triangle is the mental. Mental is what you think about. That's your physical functioning brain. And just a side note, relative to the brain, when the cranial vault, the head, is bent, the brain cannot work normal, because it's not in a normal position. It's bent, or it's compressed, or it's bulging. Okay? For your brain to work properly, your head must be close to alignment, within a B, close to alignment, and it needs to be mobile, meaning it should expand and contract when you breathe. One of the problems some of you may have with the occipital release, the microcranial therapies, or you don't breathe deep enough. The deeper you breathe, the more the head expands and contracts, and that's critical for you to get better motion, balance, and alignment. Yes?
I just wanted to say that when we first came here with Chelsea,
Yes.
she's had a lot of cranial work since then, and it's changed the shape of her head, her skull. It's changed the shape of her head, her neck, and everything, and she has made so much progress mentally and in her ability.
Tremendous progress.
Oh, incredible. Yeah.
When she's here, she takes very, very good notes. Now, the emotional part of the peak of the triangle is your feelings. If you have negative feelings, that subtracts from the quality of the function of your entire body. It's impossible to have one problem in one area. It will always have a compound chain of events. It's called synchronicity. That's the big word. Synchronicity. That means everything affects everything all the time. And when you say things like, "Oh, it doesn't matter," that's a lie. Your body knows, your brain knows, your spirit knows. Everything matters. And anytime you do anything negative, it hurts you more. And if you did negative intentionally, it hurts you even more. And when you believe more truth, the more truth you can learn, and the greater your belief in that truth, the greater your power. And this is a good year to add to your power. Now, the concept of the holistic triangle, in my mind, I think of a baby who's healthy is a small triangle. They don't have much power, but they have forces from without, the parents, the environment, the forces from within to make them expand. And the human, by divine design, is intended to grow. That's an eternal principle, to continually grow, but not just in one area, not just get smarter. You want to get better. That's not based on what you do, it's based on what you become. And you want to become a bigger and bigger triangle. See how you have more power. You have more power in all three areas of the triangle. Now, the one bottom corner of the triangle is structure. Structure is made up of your bones, which are held together by the ligaments, which have muscles attached to them with tendons, and the muscles are controlled by the nerves. It's not the other way around. The nerves run the muscles, not the muscles run the nerves. You have the joints. Remember, all of the joints in the human body are divinely designed to fit snugly and uniformly into the bone that's next to it. This morning I saw a boy who's 14. His primary complaint today was heel pain. So his trigger was, I had him walk down the hall and took a picture of him and showed him the trigger for his heel pain was his knee, because his leg is not straight, it's curved in. Now that's not a new problem, but he has not been doing therapy like he should to maintain the growth. I've told you before, the body is made up of about 300 bones at birth. But when you grow up, those bones grow together. For example, the leg, long bone, the leg, arm, has a long part and has the end. It has the other end. So the femur is made up of at least 3 separate bones. Same with the tibia, 3 separate bones. And when the bone is finally as big as it should get, the end part and parts grow together. So when you're all formed at 17, 18, 19 years old, you now only have about 206 bones because the 300 joined together. And because his knee was crooked, his heel is crooked, so the part of the bone in his foot is not lined up properly, and it creates pain. Pain is an indicator that there's a problem. The problem is a misalignment. Okay, so for him to correct his heel pain, we have to straighten his knee. Okay, and because the knee is off, the pelvis is off, and because the pelvis is off, this part of the head is off. So it's always a combination, and that's a different concept. It's a different model than the medical model. If we were to go to a medical model doctor, the medical doctor would look at the heel and say, yeah, Sever's disease, that's the name of the disease. Sever's disease. If it's hip here, it would be a different name. Osgood-Schlatter's, yeah, Osgood-Schlatter's disease. And when that happens, the disease gets treated, not the whole person. That's the difference. So how does this apply to you? It applies to you in this way. When you have a symptom, make note. And be like a 2-year-old, some of you have 2-year-old grandkids or great-grandkids. What's their favorite word?
Why?
Why? Why and no. Why and no, yeah. Be like a 2-year-old doctor. Why? Why do I have that? And always consider the concept that could the trigger be in another area? And many times it is. It's in another area. And many times the triggers are multiple. It's not just the knee, like the boy I told you about. It's a combination of things. So ask that question and then experiment. The good thing about experimenting on yourself is you'll learn quickly more about your body, and you'll discover more healing that occurs automatically. You develop more patience because natural healing always takes more time. And when you think about more time, ask yourself the question, and you've probably already done this. I wonder how long it took to make the earth. We learn about 7 days, and we think that's only 24 hours.
Times 1,000.
Pardon?
Times 1,000.
Yeah, 1,000. I took geology in college, and we learned about the age of the Earth being over, 5 billion years old, and all of the different formations around the world, the different mountains and seas and salt and all that stuff. And it took a long, long, long time. And true healing takes a long time also. Now back to the structure part. If I ask you the question, what is the most important part of the structure? Bones, ligaments, tendons, muscles, joints, or nerves? What would your answer be?
All of the above.
All of the above.
Nerves. Starting with nerves.
Works as a unit.
Pardon?
It works as a unit.
It works as a unit. And what I think about is which one of all of those of that chain is the weakest link, the one that's giving you the most trouble.
Probably structure.
Well, which part of the structure? Think of bones as one link, ligaments as another link. I was raised on a farm, and we'd have chains that would pull things with. And if I ever drove down the road and the chain was dragging, my dad would beat me. Because if a chain is dragging on the road where it's sparking and wearing out and we're creating a weak link. We had multiple chains on our farm that had repair links where one link had, we had exceeded tissue tolerance and broke the link. So we buy a new link and put in there a new link. So in my mind, when I'm looking to help you with solutions to your problem, it's like which link or two are the weakest links, and they're the ones that need the most attention back on the farm. You know, what gets the oil? The squeaky wheel.
And in my mind, it would be the nerves, because if a nerve is not getting the impulse through, then none of it works.
That's right. That's right. And if the nerve's not giving proper impulse, that's the key problem. But that might not be the key problem. It might be like the chain. You may have exceeded tissue tolerance and tore some muscle fibers, or exceeded tissue tolerance and you ripped a ligament loose, or exceeded tissue tolerance and you took a joint or a hinge too far, and the hinge stretched and became weak. I checked a young lady this morning with her jaw alignment. The jaw was not, their teeth were not lining up straight. They were off at least half a tooth, one jaw over. So I checked her head. The head was significantly distorted. And they said, okay, I'm going to do what I can, but let's check the other end. So I rolled her over and checked her pelvis. And her pelvis was, this is a medical term, skewwampus. So I said, what have you been doing? Well, she just did the ballet, some Nutcracker Suite. She was a big star in that, so she did a lot of one-sided body torque and pounding and put her pelvis out of alignment. We lined up her pelvis and went back up and checked her head, and her head was straighter, and so her jaw, the swing straight. Now, I could have spent a lot of time, and the dentist would have had a ball. He could have had $2,500 case trying to straighten the mouth. And that was not the trigger. The trigger was in another area.
Does this chain concept apply to the top of the triangle? With the links, with the spiritual, emotional, and mental too? I mean, I see how it applies in structure, but does it also apply in mental things?
Yes, let me comment on your question. Let me be totally gross. Can a person become a sinner because the brain is malfunctioning?
Yeah.
Because the head is crooked. The head is crooked, the brain is torqued, the brain is now malfunctioning and cannot function in harmony with the spirit and the emotion.
Yeah.
The answer is yes.
Yeah.
It's all related. Now, with that same concept, we go down to the other corner of the triangle. Now we have chemical, which includes what we take into our bodies. Now, that's not just the mouth. It's also the eyes, what you see, and what you hear,
The skin too, I would guess.
and what you put on.
Yeah.
It's how it's used in the body. Now we're talking about, we can have a whole discussion about the lymphatic system and the small and large intestine system, and what is or what is not discarded. I asked a lady earlier today, how is your bowel elimination? She said, poor. Well, that's a problem, because if it's not eliminating your bowel, cleaning out pretty clean every day, then you're recycling toxins through your liver and your lymphatic system. I saw a lady yesterday who told me, I saw her in the afternoon, and I said, how are you doing? She said, I was doing great all day. I had a good day until I ate. And it doesn't matter what I ate. When I ate, it affects my brain. Well, that's true with all of us. What you eat affects your brain immediately. And if you're eating things that you know are not good for you, don't do it, or do less. We all have our favorite sins. I know that. Both as omission, things you don't want. I'm not going to do that, or things you should stop doing, or you should do less of. It all affects everything all the time.
I listened to something yesterday about how the gut affects your oral health, and how your gums and your teeth and everything are not so much related to brushing, flossing. I mean, not that that's bad, but it comes from within.
It's all related. There's a female doctor, psychologist in Europe, that if you go see her for a mental issue, she won't even start treating until she has done a lot with the gut. Because unless the gut is within a reasonable degree of good function, the brain won't be either. We're going to go over the questions. I'm going to make a few comments as we do. And would someone volunteer to be the reader?
I'm a reader. You're a reader.
Go ahead.
Shall we share?
No.
Our bodies have a limited amount of energy. Thus, it is limited in its capacity to repair or regenerate every weakness simultaneously.
True. That creates a major problem, because oftentimes you will have multiple problems, multiple triggers, and you as a person will want one of those triggers, one of those pain areas, or one of those malfunctioning areas to be repaired. And your body does not have the energy available to fix everything all the time. And your body will make the determination what it needs to focus on first.
We took care of my mother and father for 17 years. And one time she had pneumonia and influenza A together, and her arms and legs stopped working so that her core could keep on.
Yeah, that's a good example. Number 2.
The body will usually devote energy to the area of current greatest need and priority.
True. The body will always do what's best for it with the energy that it has available. Now, the truth is, for most of you, you have multiple holes in the bucket. You have multiple energy losses and not enough energy input. Now, along that line, I don't believe we can be healthy in our day and age without the use of supplementation. I recommend all consider having digestion to help you get more value out of your food. I recommend that you all take a multiple whole food vitamin mineral. And this company came out with a new one for kids because when the gummy form. Now for me, this is one of my favorite now. I do both, and that's a very, very good product. In fact, I'm gonna pass it around. Pour a couple out in your hand and just suck on them. Don't chew them. If you have a bad dentist, your cap will come off. Just suck them.
Are they different flavors?
No, take a couple if you want.
It was, which are the ones you were saying, it was
I got
a
plenty here.
vitamin, mineral,
Mine's stuck
And-
together.
Digestion.
digest.
Let's call it lightning.
It's called a what?
They're little gummies are shaped like a lightning bolt. They're really good.
Oh.
Okay, number 3.
The use of diagnosing a problem by name is routinely done for the mandates of insurance carriers.
True. Number 4.
Usually, once a diagnosis has been determined, the focus of care is targeted on that issue rather than the whole body.
True. Now keep in mind, that's the current medical model. Now, am I saying to you that the current medical model is wrong? No, I'm saying to you there's more than one way to look at what's going on. And what I've recommended in my book is another way to look at your body as a whole and not be focused on a symptom approach. Number 5.
Approaching the status of the body from a holistic perspective allows for a more complete resolution of faulty function.
True. Now, more complete resolution. That's a politically correct word for, in lieu of the word cure. I would never say cure. If I said the word cure, I would get sanctioned by the authorities that say you can't, nothing is curable. Now, when I think of those words, nothing is curable, I always think of the Savior and a group of people who says, well, I'll heal the cripple, I'll heal the leper, but I can't heal the blind. Would he say that? No. Or would say, I could give you part of your sight because you only believe part of what I'm telling you. Again, the greater your belief in the body's ability to heal itself, the greater it will heal. Now, it's not fast, remember. Next.
Often the main cause or triggers of an issue actually started due to malfunction in a completely different corner of the triangle.
True, and along with triggers, it's an S, multiple triggers. When I was thinking about this discussion, I had a reflection back in my youth of I used to hunt ducks, and I don't know if you've ever been duck hunting, but typically a duck hunter will use a shotgun, and a shotgun has maybe 100 babies in it, so it puts out a big target, a big spray of babies, so it increases the chance of getting the duck. One day I was by the Snake River by Firth with my 22 with a scope, and I was thinking, I wonder if I could shoot a duck with my 22. Now that's far out, shooting it. And about then I saw a duck flying over the river. I thought, So I put my crosshairs on him. He was moving. I went in front of him, where I thought the bullet might go. I pulled the trigger. He ducked his head, folded his wings, and landed in the river. I killed him. I thought, you're a scumbag. I felt so bad. I didn't have a dog. He just floated down the river and was gone. But that's what happens a lot with medical focus. They think you have a particular virus or fungus or yeast, and they try to find an antibiotic that's only for that. Or what else do? They do a shotgun. We're gonna do a broad spectrum, and that's the shotgun approach.
Number 7. Which is the most important corner of this model? A, mental, emotional, spiritual. B, structure, i.e. bones, ligaments, muscles, tendons, joints, and nerves. C, chemical, i.e. what is taken in, how it is used, and what comes out or doesn't. D, the one that is currently triggering the most problems.
D. And you could put an S on the word one. The ones that are currently triggering the most problems.
8. Any change, positive or negative, has an immediate direct effect on all other tissue.
True. What's the word for that? Synchronicity. Synchronicity. Everything affects everything all the time, positive or negative. Now, truly, in one given 24-hour period, we may, I know a lot of you had this experience over the holidays. You had days where you had more stress, more overload than you could tolerate. So how do you compound that? What do you do to deal with that kind of an event, whether it be a day or a week or a month? You counter stress. And how do you counter stress? However you need to. If you had too much sugar, you might counter stress with water. If you had too much TV, you might turn it off for a day or two and maybe read. If you had too much relatives visiting you or too much travel, you might take a few days off. Now, most of you, I know, can take a few days off if you really wanted to. I know for a fact that if you had to, you could. Now, again, a personal example. I've been teaching 4 classes a week. I love to do that. We have small, medium, and large classes. But it's harder for me to teach 4 than 3. And I decided I need to do 3 for me, even though I would rather do 4. And so between Christmas and New Year's, we did what's called a staycation. What is that? You stay put. You eat Mama's cooking, sleep in Papa's bed, and take a nap or 2 every day, go to bed early to try to get
Rejuvenated.
to catch up. And I'm almost caught up.
Bless your heart.
And I recommend it to you. It's far easier to catch up at home than it is at Urmac. Some of you have been there. Urmac is not the place to catch up. Okay?
Having a diagnosis pronounced upon you usually triggers long-term attitudes, actions, and expectations.
Totally true. Now, if I had some name stickers, I pass them around and we could say, write on that sticker your most current medical diagnosis. Could you give one?
I've got so many different things going on, there's no specific.
Okay, could you do 4 or 5?
Probably.
Okay. You could all do at least one, right? And you could write it. What are the main causes of lowered mortality in the United States?
Diagnosis.
The main diagnosis that kills people in the United States. What? Organ failure. Heart, number 1. Now, if you look up heart disease on the internet and try to learn what is heart disease, you'll get multiple vague, non-descriptive, general. It's answers. That's like a pot of soup. It's like could be a stroke, it could be AFib, it could be congenital problem. It's number 1 because it's a big pot of soup. Number 2 is diabetes. What's the medical cure for diabetes? Drugs or change the diet? Well, it's very hard to change diets. I know that. Endeavor sees miraculous changes when people actually change their diet and do some mild nutritional support for the weak systems and function. But we don't have the cure for diabetes. It's number 2. Last year, number 3 was the current fad that we have going on. Number 4 is falls, accidents. Accidents are big killers of all ages. The number 1 killer of children are firearms in the United States. Firearms.
Really?
Now, whose fault is that? Parents, not the kids. It's the parents' fault. It's carelessness. It's lack of precautions. When I went to BYU, I took a class called First Aid, and every week we had to do a report on an accident that we read about in the newspaper or heard about on the news in detail, and then a paragraph or 2 on what could have been done to prevent it. Okay? It's a very, very good class, and it kind of opened the eyes way up and said, oh shoot, I need to do this and that to prevent. Like we had a storm in New York last week, up in Buffalo. How many people froze to death in a car?
Oh, yeah.
Now that's nuts. Those are the kind of things that could be prevented. And even when I fell and broke my hip, I could have prevented that if I'd had a nightlight, so I knew where it was. That's why I fell. I didn't know for sure where it was. That's my fault. It's been 28 months since I fell and broke my hip, and I still have a little bit of pain now and then when I do exceed tissue tolerance. I get close to it. And my little friend, daughter Denise, helps me a lot with that. Next.
A wellness-focused life requires more faith than fear. True.
11.
Even though fear can be a great motivator, it comes at a great loss of divine power that is activated and maintained by having faith in the divinely created. That's a beautiful sentence.
Keep that in mind.
True. Next.
Yep.
I am the key to maintaining the divinely gifted power to remodel, regenerate, and restore.
True. You know, I have patients over my career that come in and say, Doc, I've heard a lot of good things, and I know you can fix me now. Don't ask me to make any changes.
Give me a pill.
I got good insurance, I got a lot of money, I got a lot of time. Now you fix me. They say, you find the door. I don't want anything to do with me trying to fix you, because that's not the way it works. You fix you from above down, inside out. You have to, if what you're doing up to this point didn't work, we're not gonna keep doing what didn't work. We have to make changes. We can do them slow or we can do them fast. That's one advantage of fear. Fear can be a good motivator. That's one of the reasons that I use live blood analysis in my clinic, is because if you look at your blood, that's one of the reasons they use X-ray. If I could show you your X-ray and show you the distortion and what was costing you, you go, oh my gosh, I need to do something different. Okay?
13. Natural healing is always quicker in eliminating pain and discomfort from an injured or faulty functioning tissue.
Well,
False. It's always slower to get recovery.
It's longer lasting.
Pardon?
It's longer lasting, but it is
Yeah,
slower.
and that's why we do it.
Yeah.
I had a lady the other day ask me, so are you getting so busy that you don't have time for more new people? I said, no, I'm getting rid of my patients. I've got them all trained.
Good
As long as they do their homework, they don't need to come back. I'm not here to treat. I'm here to teach and to analyze, to make suggestions, and then hopefully to motivate you. That's part of what we have the classes, is to enhance your faith in the body's ability to heal and recover itself, and to have you learn from this, learn by yourself, about yourself, to get more hope and more faith and more confidence. When I was young, my mother's sister, my mother's Aunt Libby, lived in bed. As a young person, when we would go to visit my grandmother, we would go in the bedroom and visit Aunt Libby. Aunt Libby lived in bed for I don't know how long, a long time. And I always wondered how come she's not getting better? Well, she was not doing things to achieve wellness. She was treating symptoms, so she had bottles of medication, and she had a list mentally of, I can't do this, I can't do this. And I think she started liking what she couldn't do. And another fellow who came to me in Colorado, he was on disability. It was a big guy, and he was getting good disability. And he complained of backache and headache and neck pain, and I started seeing him and pushed him really hard to do more and take better care of himself. And he started to make really good improvement. Took him quite a while, about a year, and it was making great progress. And one day I said to him, I shouldn't have, but I said to him, if you keep getting better,
you'll get out.
you can get off disability in a few months. He said, see you later. I don't want to get off disability. Yeah, I'm making $4,000 a month and I don't have to do a flipping thing. Just collect my money. I just have to stay sick. You poor sucker. I felt so bad for him because he could have recovered. Not 100%, but he could have got back to a functional level.
I have a question. When I tell people about, this idea and about the opportunity to come here, how would you describe what your role is and what you do?
Simple.
I know it's on here.
That's what I do. I assess, I coach, I teach. Assess, coach, and teach. That's what I do. Okay?
It's hard to describe to people.
I know it is. And I also, that's why we did this discussion today. If they said, how are you different? I said, well, I look at your body differently from a different model. It's like me, like my dad. I get into his car one day and he had a pair of pink glasses. I said, why do you wear those pink glasses for? He said, well, when I put them on, everything looks so much better.
Rose-colored glasses.
Rose-colored glasses. I'll look at things different. That's why I look at things different. I look at the broad spectrum and try to get you involved. That's what I do differently.
It's also like teaching the people with questions about the T-zone. They'll get on for a few minutes. Oh, this can't do nothing for you, And you try to teach them, and they just don't go. They'd rather go on their treadmill for an hour.
Mm-hmm.
And I thought,
So now, we're done. When we talk about the T-zone, thank you very much. I appreciate you coming today.